Hello and welcome. This is Healthy India and I'm your host Lottie Alaric. Well folks, today we are going to talk about a certain condition that you and I sometimes suffer of, but some people may not realize that it is actually a health condition that can be checked, and it should be checked before it goes out of hands. So today we will be talking about sleep disorders. So to carry this discussion forward, I have in the studio a distinguished panel of guests, and I'm very happy to welcome Professor of Neurology, Dr. Manjari Tripathi from AIIMS. Welcome to the show. Then we're also joined by Dr. M.M. Mehendiratta, who's the director of the Janakpuri Super Speciality Hospital and is the HOD of Neurology. So thanks for joining us.
Thank you.
And we're also joined by Dr. Nimesh Desai, psychiatrist and director of IBAS. I welcome you to the show. So well folks, before we start asking any questions to our panelists here, let's all take a look at this report.
Sleep is a complex neurological state with the main function of providing rest and restoring the body's energy levels. Alterations in the quantity, quality and pattern of sleep result in sleep disorders. Some sleep disorders are serious enough to interfere with normal physical, mental and emotional functioning. Though there are more than 100 identified sleep disorders, the most common kinds are insomnia, sleep apnea, narcolepsy, restless leg syndrome and parasomnia. While getting a good night's sleep is essential for feeling refreshed and alert through the day, persistent and repeated interruption of sleep affects the health of an individual. To determine a sleep disorder, one has to first pay attention to one's sleep habits and daily routine. Keeping a record of sleep patterns will help the patient and the doctor find the cause of the problem. Behavioral and environmental changes are usually the first steps of the treatment. Regardless of the sleep problem, a consistent sleep routine and improved sleep habits translate into better sleep over the long term. Bureau Report, Lok Sabha Television.
Well folks, sleep disorders could be many. But before we actually try and understand the sleep disorders, Dr. Manjari, I would like you to tell us as to what is a sound sleep really like and what is it all about?
Sound sleep is sleep which basically serves its function. The function of sleep is to regenerate and recuperate. So whatever activity you've had in the wake hours, which has depleted you of your energy or has exhausted you, in sleep there is a conservation of energy, and there are several processes which go on in sleep which help you regenerate the damage which the whole day has done to you. So basically the function of sleep is to act as a nature's spa on your body, just like you go to beauty parlors. Similarly, the body has its own spa, its own capacity to regenerate, and that is through sleep. Now in sleep, the functions which happen is, in children, growth happens in sleep.
That's right.
Because the hormones, certain hormones are secreted only in sleep, like growth hormone, and the steroid levels, they drop in sleep. Steroids are related to stress. So that happens, and it helps in children grow tall and healthy. Apart from that, sleep, the normal immune functions which help us fight infections, which help us fight diseases, they also are strengthened in sleep. And the third most important thing which happens in sleep is memory. Whatever you have learnt throughout the day, whether you're a student or a worker or a technical person, if you do not get adequate sleep, the consolidation, memory has different phases. One is to receive the information, and then is to encode the information, and then is to consolidate that information, and the last step is to retrieve that information. So the third step of consolidation of memory, where जिसको आप बोल सकते हैं memory जम जाती है brain में, that happens in sleep.
Okay.
So that's another very important function. Apart from that, sleep has a very important role in cognition, in your normal thinking, your decision making, your capacity to distinguish and be judgmental of a situation, what is right, what is wrong, also happens in sleep. Apart from that, your eating, how much you eat, whether you can eat just appropriately or you overeat, and you become fat also is due to lack of sleep. So in whole, sleep plays a very important role in homeostasis of the individual. And what is adequate sleep is what makes you fresh the whole day, next day. So you should be fresh after your 7 hours or 8 hours of sleep. If you're not fresh, if you're irritable, if you're angry, if you have temper tantrums, if you have behavioral issues in children where they become hyperactive.
So the reason could be that you're not really having a sound sleep.
Sound sleep.
Okay.
Yeah. So
Dr. Mehndilata, I would want to ask you here that there's a huge debate about the hours of sleep. As she said, 7 hours, 8 hours, because the kind of work that many people are doing these days and the kind of lifestyles that people are leading these days, not many of them are actually getting those adequate hours of sleep. But what is the doctor's order here? I mean, according to the age, how many hours should a person sleep?
See, on an average, I would like to say that you need 1/3 of your day for sleep.
Okay.
If it's 24 hours, in the young children, growing children, 8 hours at least.
All right.
Once you are adult and occupied with your executive functions or others, maybe an hour less, that may be 7 hours. In elderly, especially 50, 60 years, it naturally comes down to 5 to 6 hours. But it's basically what Manjari also mentioned is, like you have to recharge your body, like you recharge your mobile.
Oh yes.
You are using whole day and you don't recharge, it will get exhausted. Similarly is the sleep, that you have to recharge, and those hours are required to re-energize yourself for the next day. And there are a lot of functions which happen. It is, we say, okay, I'm going to sleep now, as if we are going to physical inactivity, right? It may be physical inactivity, but it's a mental hyperactivity. There are a lot of, it's not a passive issue. It's an active process.
Okay.
Sleep is very active process where brain is really functioning very nicely. Other than that, you are not engaged in thinking, interacting, responding to people, but inside brain there is a lot of energy being generated.
So, Dr. Desai, would you want to add anything to what the two panelists said?
Yes, what might be useful to further add to what these two colleagues have said is the fact that if you consider the body, the brain and the mind as related concepts, as they both said, the body and the brain restorative function is very crucial for sleep. And because of that, the effects as well as the possible causes of disturbances in sleep can be significant on, as your introductory piece said, on the emotional and the mental health or the behavioral aspect. So because the body and the brain and the mind function so much in tandem, as this colleague said, most functions or many functions kind of go down on low key. Some others function on a slightly hyper key. And because of that, the mental functions, the behavioral emotional issues are so closely related to that restorative function of sleep that, to repeat, the effects of not getting adequate or good sleep can be really negative to varying degrees on those emotional, behavioral, interpersonal aspects. And so can the causes be. Of course, the interesting aspect, if we get time sometime during the hour, would be to also get into the Freudian aspects of what happens to dream and during sleep, all those aspects of
we will try
all the suppressed emotional material.
Yes. So I think that would be very interesting. Maybe we should be able to get that in. But Dr. Manjari, now what is a disturbed sleep? Because I think people per se would not be able to understand themselves that there is some kind of a disorder that they are really experiencing, because anybody or everybody at some point, may not really have a sound sleep. So one doesn't really pay that much attention to it. But which is that red flag sign?
If you are waking up in the morning and when you wake up, you feel that you should not wake up. You don't feel like getting out of bed. You feel you should go back to sleep a little more. When you get up and you are out of bed, you feel fatigued, exhausted, tired. If you're sitting watching the TV in the daytime, you fall off to sleep. Or you're going up as a passenger in the car or bus and again you fall off to sleep. Or even sleep while driving.
Right.
There can be accidents due to that. Or you feel that you are not able to think, there is a brain fog. You're not able to decide properly, you're not able to remember things. You're not able to, decide on certain situations. You're not able to plan and execute. These can all be features, daytime symptoms of, disturbed sleep. And feeling excessively sleepy, just feeling excessively sleepy throughout the day are the daytime symptoms of disturbed sleep. In the night, the patients will often those who have disturbed sleep, either when they get to sleep, they will have difficulty falling to sleep. So they'll remain awake for a long time, and they may sleep after being in bed for 1 hour, 2 hours, sometimes 3 hours. A normal person should go to sleep within 15 minutes, max to within half an hour of hitting the pillow. So normal person, the sleep latency, what we call, that is from the time you hit the pillow to the time you get sleep, should be 15 to 30 minutes, not beyond that. In children, it's 5 minutes. Children should sleep within 5 minutes.
Right.
So if your sleep is not happening for 1 hour, 2 hours, then it's a problem, it's a disturbed sleep. And if you sleep and then you wake up multiple times, and then you cannot get back to sleep, you're just waking and getting up and going back, getting up and going back, going to the toilet, coming back, you know, drinking water, getting up again, going back. So that's another sign of disturbed sleep. And then sometimes some people have what is known as early morning awakening. That is, instead of getting up, say at 5 or 6, which is there after their 7 hours of sleep or 8 hours of sleep, they start getting up at 2 or 3 or 4. So you can have a delayed onset, you can have, you know, a fragmented sleep, or you can have an early morning awakening. And all these will result in the next daytime symptoms. So those are the symptoms of a disturbed sleep.
Right. Now, Dr. Mehndilata, we have a large number of our youngsters, you know, who could be working in shifts, the BPO sector and what have you. Now, they'll all come and sleep in the daytime, but work in the night. But does that have any effect on their body clock because of these kind of patterns of sleep?
Certainly, a lot of patient comes to us. Similarly, like people with headache, epilepsy or others, we tell them that you have to have sleep of 7 to 8 hours. If you cannot, suppose there is a night shift, in daytime you must sleep for 8 hours. That may take few days to get adjusted, because from the very first day it may not be possible to have a change in sleep pattern.
True.
That may take 2-3 days, but then most of the people get adjusted and they sleep in daytime. The only problem in daytime, maybe there is a lot of noise around. In the night, 90% of the people will be sleeping. But in daytime, maybe only 1% or few individuals in that colony may be sleeping. So they have to create that environment, that room where there's not much of noise.
That's right.
No one else, family member is watching TV, playing games or making noise. So if they get that ambience of what is in the night, they can sleep well. Rather, they will sleep better or maybe more because they are exhausted. So shift duty, initially there is a problem, but later on, certainly, if they get adjusted, then there should be no problem.
What about you, Dr.
What's
Desai,
much
what would you
more
say?
difficult, in continuation of what Dr. Mehndilata is saying, our viewers will easily appreciate, is those workers in specific job patterns who have shifting duty patterns.
Yes.
I mean, you're working morning 1 week or 1 month, and then afternoon,
coming
evening,
back
and then the
again.
night.
Yes.
So as he was saying, see, if you have a fixed duty for months or years on end of, say, working night or working 2 p.m. to 12 in the midnight, then many things fall into place.
Right.
The difficulty is also that, see, ever so often, like he said, our natural day-to-day life across centuries has been by society and by nature tuned to the issues that we've been talking about till now. Most parts of the globe will have 10 or 12 hour or 8 hour night. And the human society has kind of geared its activities around that, and technology has. So fixed shift duties will have one nature of problem that people still get used to. But the regularly shifting shift duties is actually a nightmare.
It is.
To be a bit of a punning thing, it's actually a nightmare. And that's where maybe we'll discuss it in the later part, and my colleagues can perhaps say this better than I can. But there are by now methods available, medicinal and otherwise, for even those groups. But the other thing about adolescence that I wanted to bring to the table, I was going to say that, as Dr. Mehndilata was saying, in the extremes of life cycle, infancy and early childhood, certainly the first 2 or 3 years, and the elderly age period, the sleep patterns and the requirement differ. But one must also perhaps see that over a life cycle, there are biological as well as psychological need and society related patterns which will differ. And it seems to me that may not be of a psychiatric nature, but certainly of a significant social psychological issue is this changing pattern of sleep pattern that every young generation, at least I can say last 2 or 3 generations have followed. It seems current 21st century young generation and their parents face the max. many families, young children between 8 to 10 or 12 to 16 or 18 or up to 21 want to actually remain awake till 1 a.m. or 2 a.m. if not 4, and go to sleep at 3 or 4 and wake up at 11 a.m. or 12 noon or further down. Now, in the parents' view and in the societal perspective, this is like blasphemous. You know, you're spoiling your health and you're spoiling your...
Right.
And there might be some medical science base or biological science base to that. I'm not too sure if that is so, you know, sacrosanct. To me, it seems that there needs to be some kind of negotiation within families to be able to give each one whatever pattern. I should also like to say that I'm sure these colleagues based in brain sciences, neurology, then I may be more. There are physiological issues of short sleepers and long sleepers. So, inter-individual variations, job-related requirements, age, life cycle-related changes, and a few others are things that we all want to remember rather than necessarily have one rule of thumb for all the 7 billion population on this earth.
True, absolutely.
You know?
So, Dr. Manjari, now talking about disorders, if we just try and take them one by one. Sleep apnea is something that was mentioned in my reports too. Now, what is sleep apnea and how can this be identified?
Sleep apnea is a condition in which during sleep the normal breath is halted, and this happens can happen across the age. There are certain reasons in the younger age. In children, very often there is swelling of the tonsils and adenoids.
Right.
Sometimes children have a very small chin and they have a deformed kind of a small lower face, or they have fat neck. So these children, they can snore at night, and while snoring there are pauses in breath. Now, some of these pauses may not be, you know, audible to the ear, but when you test them in the laboratory, you find that these pauses are happening. And in children, if you have more than one pause in an hour, it is significant. A child should not be pausing in his breath. Whereas in an adult, if you have more than 5 pauses in an hour, and some of these pauses can be so significant that you can actually hear them snore and stop for a time and then get up choking or get back with a loud noise. You know, the breathing comes back with a loud noise.
Manjari, I'll have to interrupt you. We have a viewer. This is Alok Sharma from Rajasthan. So, Alok, are you there with me?
Yes, ma'am.
Yeah, welcome to the show. And what's your question?
मैम, मेरी मदर को सोने के बाद चक्कर आते हैं. जब डॉक्टर को दिखाया तो उन्होंने कहा कि इनर एयर के अंदर स्वेलिंग है, उसकी वजह से चक्कर आते हैं. तो उन्होंने एंटीवर्टिगो ड्रग्स लिख दिए, जिससे थोड़ा आराम आया. लेकिन अभी सोने के बाद सर भारी हो जाता है और नींद नहीं आती है. कभी भी नींद टूट जाती है और उसके बाद खराट करने स्टार्ट हो गए बहुत जोर जोर से. पहले नहीं आते थे बिल्कुल भी.
ओके.
और अभी मैम जो दवाई चल रही है वो है डाइसीजोल, डिपवेल प्लस, डिजिकाइंड एमडी, मेटफोलेट प्लस एंड एमिवेल 10 mg. मदर की उम्र 41 years है.
Okay, okay. So thank you for that question. Dr. Manjari, would you want to take that?
जो इन्होंने बोला कि सोते ही चक्कर आते हैं, तो कई ऐसी बीमारियां हैं जिसमें जो इनर ईयर होता है उसमें जो बैलेंस ऑर्गन्स होते हैं वो थोड़ा डिस्प्लेस हो जाते हैं. तो जब आप सोने जाएं पर्टिकुलर एंगल में चक्कर आ सकता है. तो उसका इलाज तो ENT में होता है. वहाँ पे कुछ मैनूवर्स होते हैं जो ENT के स्पेशलिस्ट करते हैं, वो ऑर्गन्स को, जो बैलेंस ऑर्गन्स हैं उनको वापस डालने के लिए. इसके अलावा इन्होंने बोला कि इनकी माँ की जो नींद है वो इंटरप्टेड है और नींद खुल जाती है और लेट से आती है, तो जिसको हम इंसोम्निया बोलते हैं. तो उसके लिए भी फिर कारण पता करने होते हैं किस कारण से इंसोम्निया है. और इन्होंने ये भी बोला कि माँ को खराटे आते हैं. तो खराटे आने वाली जो बीमारी जो मैं डिस्कस कर रही थी, जो ऑब्स्ट्रक्टिव स्लीप एपनिया है, उसमें खराटे आते हैं और खराटों में कई बार ब्रीदिंग में पॉज आ जाती है. देयर इज अ पॉज इन ब्रीदिंग. Or because of this pause, what happens is the oxygen in the brain comes down, because the purpose of breathing is to maintain oxygen in the body. Fresh air and oxygen goes to your brain and other parts of the body. So when there's a pause in breathing, the oxygen level dips, and if it dips more than 3%, then we say that it is a obstructive sleep apnea, which is causing hypopneas, which is causing a decrease in the oxygen level in the body. And this decrease in oxygen level can then affect the brain and the body, and when the oxygen dips, the person will get up. So there will be an arousal. So the sleep will be fragmented, and again the person will not be fresh and not be able to perform well the next day. So the purpose of sleep is lost. So it is necessary that the sleep test be done for his mother, especially the polysomnogram, which is a sleep test we do to diagnose the severity of sleep apnea. And then there are therapies available. The first and foremost thing is to make sure that if she is overweight, the weight is brought down, because that itself helps a lot in bringing down this condition. The second thing is, people who snore in the night should sleep on the side.
Okay.
So they should either sleep on the right side, right curvat, or left curvat. They should not sleep on the back. And if they have a habit of sleeping on the back, then what is advised is that in their night dress or in their night banyan, a ball is stitched in their back, you know, the banyan back. So whenever they turn to the back, the ball prevents them from sleeping on the back, and then they switch to the side again.
That's right.
Or some family member has to help them sleep to the side. There are long pillows which come, which also help you sleep sideways. So this also reduces the amount of snoring and apnea. And if these conservative measures of weight loss, side position while sleeping don't work, then you have to, you know, if it's a very severe apnea and moderate to severe apnea, you have to think of using certain machines in the night, which we call CPAP machines.
All right. We will have to come back to that. This is Sunil from Pune we have right now. So Sunil, are you there with me?
Yeah, I'm there with you.
All right. Welcome to the show, and what's your question?
The question ये है कि मैम जब मैं सोने जाता हूँ, I go to sleep at 10 between 10 to 11, okay? But मेरे को नींद आती है करीब 11-12 बजे. I wake up at 3:45, 3:30. Okay. Only I sleep for 3-4 hours. तो कितने देर की sleep चाहिए?
How old are you? How old are you, Sunil?
I am 40 years old.
All right. Thank you for the question. Dr. Mehndi Ratta, please take this.
Sunil, thank you for asking that question. You are, I will say, not 40, you are just 40. First of all, you must have a sleep of 6 to 7 hours. Maybe you are sleeping with work in your mind. When you are going to bed, you have a lot of thoughts, what you were supposed to do in daytime you could not complete, or next day what you are planning to do. Most common cause is that. Second, again, as I said, ambience. If there is not a sound proof or near sound proof, noiseless surrounding, it may get interrupted. Next, other is if suppose he is taking a cup of coffee, tea or something before sleeping, then it's likely he will wake up, because these are diuretics, and your bladder becomes full and you may have to wake up. So if all these factors, plus also the pillow should be comfortable, not only ambience environment, not neighborhood, but also the bed neighborhood. Your bed should be good, you should not have backache or those things by which you wake up. So all these needs to be analyzed. Again, before one goes for any test, most important is to sit with the patient, ask the history in detail, because time needs to be given by the doctor to the patient, and these days I will also say by the patient to the doctors, because patients are also in great hurry. Oh, I could not sleep, but just let me know, doctor, which pill I should take.
That's
so
right.
that should not be a practice at all. And what Manjari said about the sleep test, I had a patient 2 days back, and he is severely breathless. He cannot lie down and sleep, but his sleep worsens in the night. So I asked, sir, what's the reason? Nothing was coming out from the family members. Then I asked, does he go like what she was saying, snoring, snoring amplitude increasing, then suddenly comes down, stop, and then again starts and goes up. So how to document? One is sleep test everywhere, that may not be available. I asked my doctors on duty and their family members to make a video on the cell phone.
That's right. So that could be a good...
That gives me a simple bedside sleep test.
Absolutely.
And there is a monitor which tells that the oxygen dipped down. So these two were adequate enough, and then finally sleep test is required.
That's right.